Hi, I'm Rosalina Chiovitti, and welcome to the Center for Teaching and Learning. And I have here Dr. Pamela Adams.
Thanks, Rosalina. And I'm with the School of Health Sciences with the University of New Brunswick Humber College Collaborative Baccalaureate Degree Program. And the particular program that I coordinate is the Second Entry Degree Program. And we had to engage the help of the Center for Teaching and Learning.
So the exciting brainstorming process started to happen. We started to look at, as a team, what were the current tools that we were using. So here's a draft of the worksheet that we worked from, and so we decided that why not introduce a preclinical placement learning assignment, which we already had, but we were trying to look at aligning it and creating unity between the programs. And we were looking at trying to improve the quality of the student learning experience.
And the important thing that you have to remember is that with different academic pathways, although they are using the same materials, it's so important that they become or work together so that not only the student feels that they have a learning opportunity, but as well as the faculty.
Absolutely. And so when we were looking at the different exciting worksheets, not only did we look at putting prompters in, but we also put in storyline prompters. So sometimes what will happen, the student might forget that. Faculty members, again, empowered to be able to understand the storyline and enacting, different aspects of the curriculum.
That's a really good point, Rosalina, because the Ontario Mental Health Act, each one of the forms that Rosalina is talking about, it's certain characteristics of the patient. That's the story as to why you would use a particular form. And this is a really difficult area for students because now we're introducing legislation on top of what they're learning in terms of the nursing care of mental health. And so having the forms and the story helps them remember what they should be using.
There were also orientations that this was rolled out in.
And very successful orientations because we have, going at the same time, we have the generic students who are doing an intersession. We also have the second entry students that are doing their mental health at the same time. And as well, it was so successful that we carried it through even into our program that runs between January and April. So it has been well used. Our regular entry students, as I said, who come out of high school and enter into 4 years of our program. Also, our students in the second entry who are taking this program for the first time, and also our students who are doing an intersession. So when you look at the numbers, we have in one of our programs, which we call Nursing 206, we have about 80 students who are in clinical between May and June. In Nursing 215, which is the program that runs between January and April, we had 160 students, and we have only 10 teachers, around 10 teachers. So the program grounds the students. This project allows the students to be grounded. And when you come to the second entry students, we could have anywhere up to, we've increased the program, so this year we would anticipate almost double the students we had from last year, and last year we had 36 students and 9 teachers.
Oh, that is so wonderful. So we've been looking at different outcomes too, everything from process to education and satisfaction. And really, one of the wonderful things that have come out of this is the continuity and consistency in terms of information and tools and so on.
They feel that now when they're teaching in the generic program, what they can take away from that, they're also teaching in the second entry program. And this helps to unify the materials that we're using. Also, don't forget, we're one of the few schools that has a mental health practicum in order to obtain your degree in nursing. And so our clinical or agency partners, they're very used to having our students. So not only were the clinical teachers and students having this alignment, but also it helped in the clinical area, because once the students came on board, everybody knew that they were jumping off at the same point.
Wonderful. So that's it for today, and please join us again for the next installment of the Center for Teaching and Learning and these exciting projects that are going on, and stay tuned. Bye.